Tired of dealing with vein disease? Have your symptoms gotten worse?
Oh, these spider veins are ugly.
My legs and ankles are always swollen.
My legs are tired of standing all day.
While some symptoms can be managed by lifestyle changes, other factors are out of your control. Get help from the experts at Vein Clinics of Hawaii. To learn more about your treatment options, call 427-5565 or visit veinclinicsofhawaii.com. Aloha Hawaii! It's time for the Vein Clinics of Hawaii radio show. Their team's approach to diagnosing problems and developing solutions and treatment plans are beyond compare. So let's get started with your host of the show, Mike Buck, and medical director, Dr. Randall Juliff of the Vein Clinics of Hawaii.
Well, aloha, and thank you for joining us on this fine day in Hawaii. I promise you a couple things today. You're going to learn a lot, you're going to have some fun, and you're going to find out about different parts of venous disease. The Vein Clinics of Hawaii, Dr. Randall Juliff, the executive medical director, is here with us, and we're talking about you and your legs and your lifestyle. And when I say legs, it's because most of the time we do talk about legs, although you have these veins and arteries all over your body. I'm not a doctor, for sure, but I know these things because I've been sitting around listening to the doc for a long time about this. And we're going to bust some myths like that Mythbuster show. We're going to have a lot of fun today. But more importantly, Dr. Juliff, I think, and we've come to realize that when people gravitate and come to this show is they actually realize that in life almost something is going to be wrong with you. You're going to have something that needs to be looked at or cared for. And yet the venous disease that we talk about comes on so slow, a lot of people don't even know they have it.
Right.
That's amazing to me. I've learned so much about it.
Yeah. There's a vast spectrum, really, of things that go along with venous insufficiency or vein disease, and most people don't, really realize all the things and all the symptoms that one might be having if they have, this thing we call venous insufficiency. But it also changes a little bit, which most things do, obviously. Yeah. But it changes a little bit depending on what stage of your life that you're in, and that's why I wanted to talk about the topic today. What does venous disease look like in each age group? Because it can look a little different.
Yeah, the thing that I found fascinating and still find fascinating about this subject is that obviously, the most of the population thinks this is a disease that has happened to, you can see varicose veins or spider veins, and these are usually middle-aged women that are worried about their looks. That's what a venous patient is. It's not quite true, is it?
No. Yeah, that's one of the myths. One of the myths is that vein disease only happens to middle-aged women. Back when I was a general surgeon, and we talked when we were talking about gallbladder disease, there's something called the 4 F's of gallbladder disease: female, fat, 40, and fertile. That was the group of people that often had gallbladder disease, and I think typically that's kind of the same group of people that most people have an image of having varicose veins and venous insufficiency. Middle-aged women, pregnancy and having children does impact vein problems. So that's a big reason why that happens, but it just happens in so many other demographics too.
Somebody told me once, and this is a while ago, is that sometime in the roaring 20s or 30s or whatever, and then going into World War II, when legs started to be seen in their entirety. Yeah. In other words, these women would wear these short little shorts and have these legs. And so it's all about what they call them, gams. And they're all things what these legs were.
Sure.
But is that when it became, listen, this is the way you dress, and if you have spider veins or varicose veins, you're not very desirable looking. And so from what I understand, Hollywood and a lot of professions, they made people get vein surgery or put makeup on or do something.
Yeah.
And somebody asked me that after we did our last show. Is there any good leg makeup?
I think there probably is. I don't.
You can't buy it at Vein Clinics of Hawaii.
Yeah, we don't have that. But maybe we should.
Yeah.
But yeah, I think a lot of, well, not a lot, but periodically we have ladies come in and they say, gee, I'm just so disturbed by the way my legs look, and every time I wear shorts, I've got to put makeup on, and, that kind of thing. And, I think there's probably makeup out there that does a pretty good job, but it's just, it's a Band-Aid. It's covering the thing that is the problem, and there are ways to deal with it most of the time.
Okay, so anyway, today we're not really speaking as much about the cosmetic surgery or these little spider veins. I think most of us have little spider veins. It just we just either deal with them or don't deal with them.
Yeah, I think it's very, very high. 70 to 80% of people I think have spider veins. Now, if you have one or two little spider veins, does that mean you have a major vein problem? No. Probably not. But it's spider veins are the most common thing that we see.
And that's another reason, gang, why today's program, Venous Disease at Different Stages of Life, I found out that there are also different stages of venous disease, and somewhere you're going to find out where you are in the life area of business, but also at what stage of the disease are you celebrating? Are you a brand new guy? Or are you really need surgery?
Right. So some of the other myths that we have to kind of struggle with is that another one is that it rarely happens in men. Mm-hmm.
Wait a minute. I'm a patient guy. It happens in men. Trust me.
Yeah. When people ask me that question, I say absolutely not. Invariably they say, well, how many of your patients are male? And I'm not exactly sure. I probably need to figure that out exactly what the number is, but I would say it's probably around 40%.
I was going to say, my guess is, based on the times I've been to your office and talked to friends, that it's not 50-50, but it's pretty close.
Yeah.
40%, 60%, that's pretty close.
Yeah. It's not, you're right, it's not 50-50. Women have, I think, a couple more risk factors. For instance, having pregnancies.
Yeah, pregnancies, that'll do it.
And, hormonal changes that happen throughout their life. But, men have plenty of reasons to have venous insufficiency, too. And, when you walk through our waiting room, it's often that half of the people out there.
I've actually had some pretty interesting conversations because, and some of the things you learn, gang, I reluctantly at first started wearing this compression hose that we talk about a lot, and now I'm the Pied Piper of it. So I often, when I see somebody in the office, a man, talk story with them, and it's amazing how many people, if that's the only benefit if that's the only thing they followed your advice on, they're a step ahead of themselves.
Oh yeah.
Anyway, so it's. Maybe, and what about the other side of it? And that is the 40% of the men maybe put up with a little bit more of the cosmetic stuff than women want to, because they're like, I don't wear shirts anymore. I just wear jeans. I don't care about my legs.
Yeah. I think in general, men are a little less worried about the cosmetic issue. And then also men tend to put it off a little longer and don't get treated as early as many women. Oftentimes we hear that the married couple come in. It's the man that's the patient, and it's often the wife who has instigated the consultation. But it's very, very common in men also. Another myth is that it happens only in middle-aged and elderly people, and that's not the case at all either. We treat many people under the age of 30. We've treated teenagers before. But despite the fact that we always say, age is a risk factor, the longer you live, the more likely it is that you're going to develop venous insufficiency. But we see very, very young kids, too. Yeah,
I want to tell you some of the feedback I get in the public since we've been doing the show, and we're way up in the episode count. We do a lot of these shows, is that a lot of guys particularly realize that it's not about the cosmetic side at all. It's quality of life. If somebody says, I don't golf like I used to because halfway through a round my legs hurt. And why is that? Well, I'm not overweight. I'm not this. I'm not that. Why are my legs hurting? Well, because something's wrong in them.
They hurt, or two of the really main or very, very common symptoms are fatigue and heaviness. And I think those are achiness heaviness and fatigue are three very, very common symptoms. And yeah, at some point they are going to start to interfere with your quality of life.
I got one guy that my neighborhood, it's not hilly by any means, but there are some rises. And we all see each other, the regular walkers. And this one guy told me about a month or two that he doesn't do the hill anymore.
Yeah.
He still walks as much as he used to.
Right.
But he doesn't enjoy going up that hill. It hurts. So he just doesn't do it anymore. And I said, well, what? So what do you do? He says, I just go longer on flat ground. I still get my exercise.
Yeah.
And isn't it amazing the way some people will
alter
or use that rationale? Well, if my legs hurt, I won't do this. They won't hurt anymore.
Yeah.
Well, who wants to be hurt?
And we hear that periodically where people come in and say, yeah, gee, my legs have been getting worse and worse with time. I used to work out. I used to play golf or whatever. And when it starts to impact your ability to maintain good health otherwise, then, that's the time to look into it. But and then another myth that we have is that many people say, well, if my parents didn't have vein disease, then I don't, or why do I? But that can happen also. Hereditary is definitely a risk. Heredity is definitely a risk factor, and we've talked about that a lot. But and if I had to guess, I would say that probably 80% or so of our patients have some, family history of venous disease. Sometimes it's not their parents. Sometimes it's grandparents or, aunt, uncle, something. But, usually the genetics are there somewhere. But that means that 20% don't. 20% may not have any genetic influence at all, but maybe they have worked for a long time in a profession where they're on their feet all day long. They've had multiple pregnancies, et cetera.
When you think about that, and that's another whole different category that we talk about, is that there are lots and lots of people that don't even know that they're in a career that is going to lead them towards venous insufficiency because of hereditary reasons or whatever. But let's say that if you get, two daughters and one becomes a hairdresser and one becomes a secretary, the hairdresser's on her feet all day, the secretary's on her something else all day. So that therein also lies some of the areas. Yeah. Well, gee, my sister's got them, but I don't.
Right.
Well,
right.
But the one that was standing up all day has inadvertently put herself at risk for a long time.
Yeah, exactly. And we hear those kind of comments. Or, gee, I don't know why I have this because my mother didn't. Or, my siblings, they all have perfect legs. But there's a variety of different things that can lead ultimately to someone developing venous insufficiency. And you just kind of have to go with the symptoms and the findings that you might have and deal with those as they come up. So the first category obviously would be the very, very young, and in this category we always have to be, and by very, very young I mean less than 8-10 years old.
Wow.
Now that's rare, but typically that's a congenital kind of thing. It's a problem that they were born with, and luckily it is rare because often these kind of problems with congenital, vein abnormalities are typically difficult to remedy and correct. But so it's definitely not run of the mill kind of venous disease.
Would a young person, Doc, feel, if they're symptomatic, they don't know what that is? So I mean, they don't know what to look for. So I'm wondering if some of the signs that come up as we get older are a warning bell goes up. I don't think in a young person that...
in a young person, they're not going to be as sensitive to that, or know the difference, obviously. But I think that probably the thing that happens in the very young who have congenital problems, usually there's a superficial sign, and so it makes it a little more obvious, makes it of course, a little easier to identify, luckily. But when we talk about congenital problems, often it has to do with a couple of different things. There could be a congenital absence of valves in the veins. We talk a lot about the valves the one-way valves in veins that keep the blood moving upward, and those valves can fail. When they do, the blood goes downward. So
isn't the valve thing mostly the crux of venous disease?
For run-of-the-mill primary venous insufficiency, valve failure is the crux. Yeah.
And you know what, gang? We found out, we've answered these questions before. There's no pills for them. I mean, and if you are like me, if you have these valve issues, you need to have work done on those veins. And the good news is that when Doc talks about hereditary and everything else, if you knew mom or dad or grandpa or grandma when they had their veins treated, boy, is it different today. I mean, with the diagnostics and the treatments, it's a in-office procedure that you walk in, you walk out.
Yeah. Luckily, it's much different than it was before. So within the congenital form, it's just absent veins or absent valves. It's not that they have failed; it's that they're not there, and that's the way the patient was born. Or even there's an entire venous portion or venous system portion of the venous system that's just absent. We refer to that as aplastic. That's a medical term that means that it hasn't developed in a normal sort of fashion. So, in some young kids, they're born with this congenital defect where a part of the venous system isn't even there.
Well, when would that become apparent? I mean, you can't help but see when a baby is given to his mom, or right after birth. You have a tendency to count fingers and toes and make sure there's only 2 ears and all the kind of things we do.
Right.
But I just don't know whenever especially in an infant, that there is a problem.
Yeah. Well, usually it's going to be some abnormality, swelling. Little kids can develop varicose veins.
Wow.
And often that's the sign. If a young kid is developing varicose veins at the age of 4, 5, 6, then obviously there's a problem with their venous system. There's no question about that. That goes way beyond the typical run-of-the-mill primary venous insufficiency that we think of in adults. So there are signs often and unfortunately that make it obvious, and so we embark on doing things that are going to completely define it. Many of the congenital venous abnormalities have to do with vascular malformations, and what I mean by that are vascular kind of structures. You might think of it as a birthmark. Many people will have birthmarks of one type or another, but in those individuals, especially young kids, if they have a large purplish kind of almost looks like a bruise, but a little more defined, and obviously it doesn't go away, but that's something that we might refer to as a venous malformation. And there's different types of malformations, but usually they're on the skin, and those will be sort of a sign of something amiss.
Yeah, it's very interesting you say that, because all of us, especially in Hawaii, when we are running around with less clothing than a lot of other places, weather-wise, that you'll notice these things either in yourself or somebody else. And I never, until you said that, I didn't realize that some of those things, the birthmark or whatever, have a venous connection.
Vascular.
Never knew that.
So you have to be that's a sign, and you have to be a little wary of it. Even and I've seen some. I have treated some younger individuals, not really young children, but in their 20s, in early 30s, that have venous disease, but they have they may have a superficial, venous malformation. And you have to be you have to tread lightly. You have to, kind of overly evaluate these people and kind of choose your treatment plans very, very closely, because there are some pitfalls in treating people with those types of problems. And when we see a congenital kind of venous problem, especially in the very, very young kids, you have to treat. Is there treatment? Yeah, there is treatment, but it's varied. It's not it's not a cookie cutter kind of thing, and you have to be very, very careful because you don't want to make things worse.
Yeah, yeah, very interesting. And what we're talking about, fortunately, is a much smaller percentage of all of us out there, right? So don't be worried that if your kid has a little bruise that you got a venous area.
Again, it's usually with respect to your question earlier. How do you know? It's usually obvious, when the little kid has something like that. But so the next age group are teenagers, and we have treated, like we've talked about before, we've treated a substantial number of kids in this age group. If it's a garden variety kind of venous insufficiency, then most of the time they're going to present with varicose veins at a young age, and again we've seen a handful of kids in their mid-teens that have come in with varicose veins. And typically, it's a child that has a very, very strong family history, and that's why they're developing it.
I know you've treated these young people. It's not anywhere near as frequently, but I would imagine that it gets pretty tough on some of them in school. I mean, kids can be kind of, hey, what's that thing on you?
Yeah.
And this kid must go home and say, Mom, what's this thing on me?
Yeah. That's a big part of it.
Yeah.
Even though they're certainly having symptoms, although young kids they're out and around active, and I think that they have probably even an easier ability to ignore symptoms because they just don't let it bother them because they want to be out doing stuff.
Yeah.
But yeah, so especially in that teenage group, if they have any problems like varicose veins and superficial stuff, chances are they're going to get teased, and so that's a big part of why they come in. Actually, the majority of this group of people, teenage kids, the majority have actually been young males that we've treated.
That's interesting, right? Because later on, it's the percentage is way different.
Again, most of the time they have complaints of varicose veins. That's their primary complaint, and and the aesthetic concern is always there. Many of them have been athletic. Mm-hmm. So I think that probably that plays into the progression of venous insufficiency and varicose veins at a younger age.
Do some of these kids, Doc, do they feel that it's because of an injury, or they fell out of the tree, or this is that way because I got hurt?
Yeah, that's always a question. Mm-hmm. That's always a question. Yeah. Usually it's not, but I have found it interesting that many of them have been young athletic males, and it's probably because of the fact that they have the hereditary factor. Mm-hmm. The veins have failed, or the valves have failed at a very early age. Mm-hmm. And they're probably outstressing their venous systems because they're working out, they're playing football,
pushing the limit. That's what they do,
lifting heavy, lifting, and when you're straining in that when you're straining, especially your core, that is putting a certain amount of pressure on the venous system, and that's going to tend to propagate and advance the problems that are happening.
There's one thing I want to do, and I think I've done this on a previous program, and I know how much we have to do here. VeinClinicsOfHawaii.com, by the way. Don't forget, go to VeinClinicsOfHawaii.com. Bodybuilders. There's this great pride in these guys that they love these veins that pop out.
Yeah,
and I guess it either looks macho or looks strong or looks something. Is that sometimes because of that pressure you're talking about? The what do they call it? Isometrics or whatever it is.
Right, exactly.
That cause that pump up.
Right.
The pumping up. I'm going to pump you up, right?
Yeah. Well, you're right. We've treated several bodybuilders, and they do like that real veiny appearance. Yeah. Now, part of the reason why they like that veiny appearance is because it kind of indicates how much body fat they have.
Yeah, or don't. Yeah.
Or don't. Yeah. I mean, the lesser amount of body fat that you have, the more prominent your veins are going to be. But some veins look normal. I mean, just observing them, if veins are very, very prominent, some look normal, some don't.
Yeah.
And I can remember treating a bodybuilder on Maui a couple of years ago who came in, and he had bad vein problems. There's no question about that. Had a tremendous amount of varicose veins, but he was pretty specific about getting rid of some of them and leaving others.
Yeah, of course. Well, it indicates It is macho looking. I mean, even some of the gals that do this, I mean, those that go over the top are over the top in anything. But there are some that just see that. And I've been amazed at some, and maybe you can explain this happens. Let's say when somebody flexes, one will actually pop up a little bit. Yeah. Is that really happening, or is that the muscle, or what does it make it look like that vein's jumping out?
Well, when you work a muscle, when you stress it, there's going to be fairly quickly more blood flow into that muscle, and if there's more blood flow going into the muscle, then more blood flow has to come out.
There you go.
So I think that's all part of it, and also the muscle is kind of pushing that vein, more superficially. So they love that, but
it is interesting, and it just compiles, gang, the vast cross-section of all of us that need to be at least aware of some of these things, particularly as Doc goes along explaining not only what the condition is, but what possible symptoms there are to give you an idea that you need some attention.
Yeah. So how do we treat kids? Well, if it's again run-of-the-mill kind of stuff, the teenage guy with typical varicose veins from hereditary valve failure, then we're going to treat those kids like anything else. We're going to do the venous ablation type procedures on the underlying veins, and we do phlebectomy to get rid of the varicose veins. If we're treating a patient with the congenital type of venous insufficiency, like I mentioned before, we have to be very, very cautious because, for instance, I mentioned before that maybe a child is born with an absent system of veins. We've talked about before the deep venous system and the more superficial venous system. And we can do things to both, but most of the time we're doing procedures on what's called the superficial venous system. Well, let's say a kid is born and has an aplastic or an absent deep venous system. Well, they're going to come in with real dilated superficial veins, and it's going to look like typical, varicose veins. And somebody might say, "Gee, we need to get rid of this. We need to treat it." Well, if those dilated superficial veins are the only
I was going to say, what if that's all you got? Now what do you do?
Then that's a problem. And so that's why I say, we have to, when we see something that we think is congenital, we have to kind of take a step back, make sure they're fully evaluated, and tread very, very lightly and treat. Typically we try to treat as minimally as we possibly can.
To me, it's interesting, gang, that first of all, Dr. Juleff, the 4 offices here in Hawaii on 4 islands get to a place where you can be monitored and everything else. Because one thing you just said, and I know that was in my case, that some of the work that I've had done, some of it was recommended. You should do this pretty soon, and we'll just keep an eye on this. So I'm guessing that these young people that would be the preferred treatment. Let's just keep an eye on this before we do anything drastic. We may never have to. Maybe this is all it's going to be.
Right. You're absolutely right. Yeah, we try to be as conservative as we possibly can, especially with that age group and that venous disease type. But compression always plays a role. Sometimes congenital venous disease we'll treat just with compression. But getting, with respect to the teenage males that we have treated, getting them to wear compression stockings can be a little bit of a chore.
However, I must tell you that now that you see these in regular sports, and now you're starting to see them pop up in a lot of places now. They may be not clinically as acceptable to you as they are to a guy wearing them, but wearing something's better than not doing it at all.
Oh,
right?
yeah. And
they're fashion statements.
Well, they can be, yeah. And luckily, there's a wide variety of compression stockings out there now. Luckily, and I remember one young teenage kid that we were treating. He had a real hard time picking out or trying to come to grips with wearing a traditional, type of compression stocking. And so he finally settled on a sport kind of sock. And again, luckily that those types of options are out there now, and we can pretty much find a stocking for anybody's taste, and needs. So,
by the way, you can also, I've done it just for fun. It's all over the internet. I mean, depends if you can't get the right kind, and with shipping and cost and everything else, it's actually kind of neat to experiment around and then find something you're happy with. Because if you're happy with it and you made the selection, you're more likely to use it every day, like I do with mine now, and you do every day.
Absolutely,
like me,
we sell compression stockings in our office, but if somebody has found an alternative type of stocking that they're happy with, that's going to serve the purpose and they're comfortable and whatever, then I'm more than happy to have them wear the stocking that they are comfortable with and that they will wear on a daily basis.
Yeah, I got to tell you, I'm impressed with some advertising on our station now on a national basis. There's this sock company now that apparently has 17 sizes.
Yeah.
It used to be you want this one or that one. Now there's,
Yeah.
So good. People are paying attention.
Yeah, sure. So, so going up the age ladder now, those patients, the next category would be those patients that are kind of like teenage to 30-ish. And, of course, this is, it becomes, a fair bit more common in that age group. We always have, a good number of people in their 20s. Again, most of these people also, since it's occurring so early in their life, they have a strong family history. They may not know it. They may come in and they say, well, gee, neither of my parents, had vein problems. The parents may have had it, but they didn't talk about it. That's one big thing. Or they had it and they didn't expose their legs. Or they didn't do anything about it, and it was never talked about. But usually it's in the genetics somewhere.
I'm going to guess, and we don't have to spend a lot of time with this because I don't know how much ground you want to cover. That it doesn't reverse. In other words, if you have this disease, it's not likely to just go away.
Right.
If anything, over time it will progress.
Yeah, it absolutely does.
Yeah,
that's a given. And we get that question, especially from the younger age groups. Should I do something about it now, or is it just going to get worse? And et cetera. And typically, I tell these people that you should probably have it fixed because it may or may not get worse, it may or may not recur, or you may or may not have other problems. The younger you are, and the longer life that you have in front of you, obviously, the more likely it is that you're going to have some problem in the future. But there's no reason to put up with the symptoms that you're having now, even though you might have other problems in the future.
Yeah, and by the way, gang, in other programs, we do the 6 different stages of venous disease. And you need to find out where you are in that. That's why one of the upshoots, when you hear this program, that you want to know more on, you got to go to veinclinicsofhawaii.com. veinclinicsofhawaii.com. Great website. They get really interactive. You can see a lot of good stuff. But I guess that means that, and it's all about awareness. I mean, we do this program. It's really just to make people aware that you might have something you might want to check out one of these days.
Sure. Yeah. Right. So, when we get into the mid to later 20s and 30s, obviously these people not only are having, the hereditary aspect, but, they're starting to have children. They're, so they may have multiple pregnancies by the time they're, early 30s. And that certainly impacts the progression of venous insufficiency if you're going to have it. There is now a greater number of people who have spent, a certain number of years possibly in a profession where they're standing all day long. So we see a little more wider spectrum of reasons why they may be developing venous insufficiency as they progress in years. In my own experience, patients of all of our patients, the people that we've had to deal with very, very extensive varicose veins, those we have seen more of those in again mid to later 20-year-old men, and I've just always thought that was very interesting. But I can think of 3 or 4 right off the top of my head that they came in. I mean, they just had terrible varicose veins, and again, I think it's probably a combination in them. It's a combination of genetics and also just a physical lifestyle that has made the that venous insufficiency and the dilated vessels, progress with time. So
that's why I asked. I mean, that's why another question that comes to mind for me is that, while we talk about it as usually thought of as a women's condition, there's any number of medications you now hear and see advertised on television, and always one of the caveats: if you are pregnant or thinking of becoming pregnant, blah blah blah. Isn't so? This means that this group we're talking about, the pregnant women with multiple pregnancies, they're very lucky if they get away with not having too much vein disease.
Yeah.
I mean, even hereditary or not, isn't their body doing a bunch of stuff that our male bodies just don't do?
Yeah. There's a number of things that happen during pregnancy that really kind of can lead to vein problems of one sort or another. And even in those women, there's a good number of women that will have venous related types of problems during their pregnancy. Like swelling, and even dilated varicose veins, and then after the pregnancy it goes away, and they go back to something that's probably close to normal, and they may never be treated for venous disease in the future. So pregnancy really has a major impact on the body. There's no question about that. How do we treat these people, in the 20 to 38-year-old age group? Well, it's, most of the time it's just run-of-the-mill primary type venous insufficiency. We treat them in a routine fashion. I think the more important thing about this age group is that it's even more important to do good follow-up and surveillance because of the fact that, again, they have a good number of years in front of them. And is it likely that they're going to have other additional problems in the future? Well, it's pretty likely because they've got a lot of years to go through. And so we try to keep track of those patients with periodic, what we call surveillance ultrasound. Try to catch things early, make sure everything that was corrected before remains stable, and address problems earlier than later so that hopefully it's a simpler fix.
Yeah, and gang, I've met people in the clinics before, and don't forget, it's veinclinicsofhawaii.com, veinclinicsofhawaii.com. Can't tell you that enough times. That I think that this is terrific because, we're sort of programmed at the early stages in grade school and stuff about the dentist. You have to have the dentist and you have to have the checkup. That's an annual deal. But once you're out of that and you're a free, independent thinking young person, you may put some of that stuff aside. Yeah. And you don't realize that how much can go wrong between visits. Look at how often somebody will come into your office and say, well, I had some veins done a while ago. Well, what's a while ago? 10 years.
Yeah.
What have you done since then? Just to keep checking the monitoring you.
Yeah, exactly. I mean, there's a number of different things that it would be recommended to kind of keep track of from a medical standpoint. And going to the dentist is one of them. You've often mentioned, checking your birthday suit on your birthday.
Exactly. Dermatologists love that.
Go to the dermatologist. But, venous insufficiency, if you have it, is one of those things. You need to kind of keep track of it. And I think that's one of the things that we did very, very poorly before. Back in the day when we were doing, a lot of surgical vein stripping, people would come to the hospital, have vein stripping, and then we'd say, see you later. And we didn't have a real good follow-up for those patients. So even now we see a tremendous number of patients that like you say, had venous vein stripping 10, 20, 30 years ago, and now they're kind of bouncing back with new symptoms and new findings. Whereas had they had good follow-up back originally, then probably very minor things could have been done to control it.
And one of the things that came up the other day, gang, in another area of what I do, and that is with these new devices that we have now, smartphones and everything else, we have ways that we can remind ourselves something. So you can say in September, I had a vein, fixed. So I'm going to put September. And in September, I put a question mark in my Outlook and say, do I need a vein checkup? Wouldn't that be cool? And I think that patients now appreciate when officers are reaching out. It's not about getting you back in to charge you more money. It's to get you back in to continue treatment of a condition that really should be treated rather than wait until you are symptomatic real bad.
Sure, yeah.
So think about that. Make it regular. You do your dentist, you do your eyes, you do your ears, you should do your veins.
Yeah. And we try to make it as easy as we possibly can for our patients. I mean, we keep track of that.
Yeah.
And if we feel like a surveillance, typically we try to get patients back in about every year, to do an ultrasound, and so we'll have them in our system, and we'll give them a phone call and see if they want to, etc.
Yeah.
Some people, because of the extensiveness of their disease or other problems, we may want to see them before that. So we'll put them in the system, and in 6 months, give them a call and have them come in. And,
it's to me a great service provided by the practitioner, and that's why at VeinClinicsOfHawaii.com you can find out about that kind of stuff. It's really, to me, it's now that I know about it, and as I'm getting older, there are no options. You just got to keep an eye on stuff.
Yeah. So the next age category would be kind of middle-aged patients, and by that I mean probably 40 to 55 year old. And in this age group, I think that probably women do predominate more so than in other age groups. Again, we've got plenty of men in that age group too, but women during their childbearing years, basically, is what it boils down to. That,
by the way, that age is shifting a lot now, isn't it? That a lot of women go to school and do things before having a family.
Well,
so
that's true.
There's even some risk now that some of these gals are getting, pregnant into their 40s and 50s.
Yeah, So again, mainly women, and why is that? Well, again, they're childbearing age and they're having pregnancies, and during pregnancy, as the baby is growing and the uterus is getting larger, it's having an impact on the large veins in the pelvis. In that same area,
it actually pushes on them, doesn't it?
Yeah, right. The uterus, rests on those veins, which obviously that's going to be a mechanical problem with blood flow, basically. So, and all of the veins in our legs are, as the blood is making its way back up toward the heart, are going through these, fairly large veins in the pelvis. So, not only is it a mechanical problem, but there are hormonal issues. The hormonal fluctuation that occurs during pregnancy is having an effect on, how those veins constrict or dilate. They make veins a little more flexible, and also the blood volume within a woman's body increases tremendously during pregnancy. And that has an effect.
When somebody's doing the prenatal care, their OBGYN or whatever, is that a time when a lot of practitioners will refer to a venous specialist? Okay, you need to get this looked at because you're still going to be pregnant for 3 more months,
right?
And this condition probably going to need some treatment. But from what I understand from previous shows, you don't like doing very many serious procedures when someone's pregnant.
We don't do any procedures when they're pregnant, but do I encourage them to come in with the problems that they're having, especially early on in their pregnancy? We like to see those people or those women, and just to kind of evaluate them at that point where they're beginning to have problems. The later it gets into the pregnancy, I think the more I would say, well, let's just wait until you've delivered. Come on in after your delivery.
I need to ask that, and I'm sure people would be curious about that. Let's say that someone's just given birth.
Yeah.
And that means a lot of pressure is off because this this wonderful thing that was inside them is not inside them anymore.
Yeah,
and their body is doing what it can
recovering.
to recover. So that must mean that if there are conditions that have come along during the pregnancy, that's when they're going to manifest. That's when you need to get looked at.
Right. I think, after they deliver, then we like to see them and see where they are. Because some of those women, as I mentioned before, some of those women who have developed vein problems during their pregnancy, some of the vein problems are going to go away. It was just a problem of pregnancy with the mechanical problems and the hormonal fluctuations. Many of them don't. Many of them don't go away. So, so we evaluate them at that point, once their body has recovered back to, whatever the baseline is going to be. Now, the next question, of course, is, we get this question, gee, doc, are we, my husband and I probably will have another child or two, but I've got all these vein problems.
Yeah.
Should I address it now, or should I wait till we're done having kids?
Yeah.
And usually what I tell them is, especially if they have substantial, vein problems, usually I say, you should probably just go ahead and have it fixed, because
particularly, I bet if they're symptomatic, if they hurt or they throb or whatever.
Exactly.
Right?
Yeah. So, we do that to eliminate symptoms. Why live with the symptoms if you don't necessarily have to?
Absolutely.
Number one. Number two, if you have pre-existing vein problems and you're going into another pregnancy, then they will definitely get worse. They are definitely going to progress. And also there's some risk of having a more major vein kind of event. If you have pre-existing venous insufficiency and varicose veins going into that pregnancy, you're more likely to develop for instance, a DVT or something that we call a superficial venous thrombosis, or some acute sort of change in the venous system that you don't necessarily have to go through, or wouldn't have had to go through if it had been fixed before you went into that pregnancy.
Only if, yeah.
Yeah, only if. And typically, when we fix things, the vein issues that we fix in women before a pregnancy, typically those things don't need to be refixed. If they do have another pregnancy or two, if they have further problems after additional pregnancies, usually those are additional vein issues.
And what I really love about doing this is, like I said, once you find out where on the chart of this disease you are, when you get a vein treated, that vein is never going to bother you again because it's been treated. That doesn't mean that you're not going to get another one somewhere down the road, but that must be the gratifying factor of what you do, knowing that when somebody comes in for a procedure, that part of their symptoms or that part of their misery is done.
Right. So then the other issue is DVT during pregnancy and during this age group of women. And obviously, if somebody develops a DVT, it's going to impact vein function and vein health over a long period of time. And we've talked about this before. Pregnancy in and of itself sets up what we call a hypercoagulable state, where your body is, again, because of the mechanics and the hormones and all this sort of stuff, you're at a higher likelihood of having a DVT.
Yeah.
And so you have to be concerned about that. Again, that can also impact ultimately developing venous insufficiency or other vein problems during this age group. The next, and then, the other thing we talk about also in this particular age group, middle-aged women, is the use of birth control, and birth control pills, depending on what kind they are.
Yeah, you know what, Doc? You hear that a lot on the TV shows.
Yeah.
And so obviously there's a lot of reasons that problems can arise when you are doing that. So, I mean, you have to know whether you really want to do that or not.
Right. Exactly. And there's different forms of birth control. There's the patch and intrauterine device, and there's more than just birth control pills. All of them have their own set of risks. But some birth control pills do increase your risk of DVT, and you just have to be aware of it. there is an increased risk that occurs. Typically, if you're premenopausal, if you're still in that childbearing age group, and if you use some of the more typical birth control pills, your risk of developing a DVT is 2 to 7 times the rate of if you were not. Now, that sounds like a big number, but the overall risk is, the percentage of people developing DVT is not huge. But you just have to be aware of it and be cognizant of making the decision that you definitely want to concerning your situation and your mindset, how you feel about it.
Okay, one thing, and up to this point, before we go on to our elderly folks, one thing that we haven't talked about is most of the time, I think we address people that are fairly normal. And now we're getting more and more conditions, male and female, where we're not normal. We are sedentary. We don't get exercise. We eat too much. I used to be diagnosed as morbidly obese. Knock on wood, that's all gone. But doesn't that also play a factor in many diseases, and particularly venous disease?
Yeah. Obesity is one of those things. It's definitely a risk factor for vein problems, and also, as we've talked about before, this thing that we call lymphedema, which goes hand in hand with venous insufficiency, especially in the obese. And as we age, as we go from as we go through that middle age bracket and into into our elderly years, the greater the risk of being obese or
he's
overweight.
Kind of being nice to me because that's kind of where I am, what I'm looking at. But I find more and more people are looking at that saying now, okay, I needed a reason to change my life, and I got a scare because this failed or that failed, or I had a heart attack or a stroke, or I got a DVT or blah, blah, blah. This is your body telling you you can't keep doing this stuff if you want to be around.
Right. Yeah. Exactly. And, obesity. There's so many different, medical problems that, as you know, arise from obesity that can be reversed if you address it as you did. So that's a good thing.
There's a long list. Someday, when we get a minute, you and me, listener, I'll explain the whole thing to you.
Yeah. So then the elderly age group, and a lot of people hesitate to come in those upper age brackets, but I can tell you we treat many people in their 80s and early 90s.
It's about quality of life at that point, isn't it? Just being able to enjoy the day.
And typically in that age group, it's not about the aesthetics at all, certainly. But there's just so many symptoms that can arise, in the elderly that have to do with venous insufficiency, and there are things that can be easily done to help that. The deterrence it makes it a little more complicated. I mean, people who put off being evaluated because they're elderly, then eventually they get to a point where, gee, this is just too bad. I need to do something about it. Then now a number of years have transpired, and it makes it a little more difficult, maybe a little more risky, when you could have done it at an earlier age and gotten through it very easily. And as we get older, there's less mobility, and it is a little more difficult for many people in the upper age groups to get over the procedures, depending on what they need, like anything else. But they can do it. But it's in some cases it's better had they done it 5 years before that.
That's what this exercise today is. That you can go to veinclinicsofhawaii.com to find out a lot more. But what we're trying to do here is just sort of stimulate your thought pattern so that you can say, where am I? And, which group am I in, particularly as we get older, right?
Right, yeah. And one thing that I often talk to people about when they talk about maybe their parents or the patient themselves when they're a little more elderly is there are two symptoms, cramping and restless leg syndrome, that can be very, very common in the elderly age group and can be so impactful for their quality of life. And those are two things that don't normally go along, or in their minds go along, with venous insufficiency. And we just have so many people come in after we treat them and say, gee, I'm not cramping at night, I'm getting a good night's sleep, and things are great. So they don't have to hesitate, even though they might be in the elderly.
Yeah, and what we hope today that you've learned a little bit about just being a little bit more aware of what's around you, what's going on. And if you need to know more, and I expect that you will, particularly if you're in one of these categories that we talked about today, you've got to check it out. You got to go to veinclinicsofhawaii.com. That's veinclinicsofhawaii.com, and make an appointment and come see and get that ultrasound, get that diagnostic stuff done, and find out that, hey, I feel a lot better. If your legs are healthy, your life is healthy. And that's what we're trying to do here. So please join us again next time. And for Dr. Juleff and the medical group over there at Vein Clinics of Hawaii, we thank you very much, and we'll see you next time.
Well, that's our program for today, and we certainly hope you enjoyed meeting us. Please come back next week for our next episode. And in the meanwhile, to learn more, please visit our interactive website, veinclinicsofhawaii.com. That's veinclinicsofhawaii.com.